Welcome to the CTA podcast. Join us as we critically examine the ideological capture of the psychotherapy field. Here we discuss better, common humanity proposals for a fairer society. Our discussions are thought-provoking, and our guests are from diverse backgrounds, bringing unique perspectives to the table. This is the CTA podcast with your hosts, Jaco van Zyl and Christine Siefen.
Welcome, everybody, to the CTA podcast, and we're very excited to continue on with our authors series. And with us today, we have author Tim Courtois, who is a licensed professional counselor based in Michigan in the United States. And he's been practicing since 2006 and has received a certificate in narrative-focused trauma therapy from the Allender Center and a sexual health certificate from the University of Michigan. Tim's work is specialized in issues related to sexuality, including sexual abuse, trauma, and sexual identity. So welcome so much, Tim. We're so excited to have you here. And in continuing on with our authors series, we just want to introduce, kind of start by introducing the chapter that you contributed to the book. So the book, once again, for our listeners, is Cynical Therapies, Perspectives on the Anti-Therapeutic Nature of Critical Social Justice. And the chapter you authored is called Critical Social Justice, Indoctrination in Sexuality Education for Therapists. That is a mouthful. Wow.
Yeah.
We're very excited to unpack all of it. So we'd like to start with maybe just telling us, if you can give us a little just bit of information or some background about what interested you in writing about this in particular. There's so many issues that critical social justice has touched, right, for all of us in this field. So what spoke to you the most that led you to write this chapter? And then we'll go ahead and go from there and kind of look at some of the things that you had have written and break it down a bit. And
Sure. Sounds good. Sounds good. I mean, well, what interested me was that this is really just my story of how I encountered this stuff impacting our field. I, had some awareness of, critical social justice and how it was kind of sort of becoming more prominent in culture, but I had no clue the extent of it until I signed up for this training program through the University of Michigan that they run in conjunction with ASECT, that's the American Association of Sexuality Educators, Counselors, and Therapists. And so that's the most prominent body for educating and certifying sex therapists and professionals specializing in issues of sexuality in the United States, but it's also known internationally. And so I signed up for this program and was just completely shocked by what I found there, the intensity of it, the degree to which it was more of an indoctrination program than an education program. And so, probably in contrast to some of the more technical or theoretical chapters that might be in this book, this chapter is really just the story of what I encountered in this training program. And I wanted to write it because I was so blown away by the extent of what I found. And I felt like, well, this should at least be known. People should be made aware of that. This is the kind of thing that's passing for training and education currently. I went in, paying a lot of money thinking I was getting an excellent professional educational program. And I got an education, but not what I was anticipating at all.
Absolutely. Yeah, and I wanted to just point out, because really early in the chapter, and I think this is, I love that you were able to kind of start off by saying what good education means. What does that mean? Sort of these 3 points that you have here, like the 3 C's almost of good education. So I'll just kind of name them real quick, but
sure.
So the first one you start off with is that education should develop in students a liberal conscience. So the C there is conscience, where people can think freely, choose for themselves, and introduce them to a well of knowledge. And I think this is so interesting. Maybe you can speak to this in a moment, because it's almost as though we talk about sort of these liberal values, but in essence, they have become so intolerant of anything that steps outside of what they believe to be the liberal values are that we should be following, that it's actually just kind of cancels itself out there. The second component that you mentioned here is curiosity. And that's something that speaks to me quite a bit, because one of my mentors that when I was first practicing was, kind of gave me this mantra of stay curious and wondering by exploring, asking questions. So I see this word curiosity, which again is sort of the antithesis of critical social justice, where we're not allowed to be curious, right? We're supposed to already know. And this third component of caution, which I think is so profound, because you say here that we need to address, or at least acknowledge, that there are limits to what we know, because that allows for us to learn and grow and add on, and to be wrong. I think to be able to go back and say, time has passed. Maybe we were wrong about this, or maybe there's something we didn't consider. So if you just kind of, I don't know, want to speak a bit to those kind of principles that you felt were lacking in your program, and then
let's see where I go with it. I'll say a couple things. Just one, hearing you mirror those back to me right now, I'm struck by how much those principles are core, not just to education, but especially when it comes to therapy, where our work as therapists is to, in some sense, learn from our clients, to discover freshly, who are you? What is the landscape of your life? What is your story? And what is the way that you want to go? We don't come in as all-knowing experts who have a blueprint for how life should be lived. And anyone who approaches clients that way is engaging in a form of control rather than seeking to help them become more fully alive and become more responsible human beings for their own life. And so, especially as therapists, to be curious and humble and say, I don't know what you should do with your life. My role isn't to tell you what you should do with your life. My role is to help you discover what you are going to choose with a level of responsibility and freedom. So that's really striking to me as therapists, how important that is. But then also in education, that what we're doing is, whether it's education of children or education of professionals, all the way up as adults, are we hoping to create automatons who have in their mind a list of right answers and the sort of restricted scope of what counts as expertise or correct thinking? Or are we hoping that we will develop individuals who are capable of thinking for themselves and discovering new things and navigating a world that is more complicated than we will ever be able to unpack completely? I think there's I think we've seen this a lot in recent times, where there's this tendency to flex authority and quote unquote expertise in a way that shuts down conversation and says, no, I have the established correct answer, and so nobody can challenge me, nobody can question me, and what you need to do is just adopt this correct answer and repeat it verbatim. And that's if you want to call that education, fine, but let's at least be straightforward about the fact that that's what we're doing.
It's not effective education either. It wouldn't be effective therapy. And even if you just think about the concept of self-knowledge or insight into ourselves, there's got to be this freedom to explore. There's got to be this invitation, this holding environment such that the person feels safe enough to remain curious. And once they discover something, to remain curious still, to be cautious around our conclusions. Not only in education, but also in therapy, as you pointed out.
And in life, as human beings, like
the life position.
There's this sense that like, oh, we think we've come so far, we're so enlightened now, we've solved it. We've everybody in the past was ignorant or didn't know, didn't understand, they didn't have science, but now we've got all the answers. Now we've sorted it all out. And so now it's just a matter of passing down the answers we found from one generation to the next. I think this is something you see, I don't want to create straw men to fight against, but this is sometimes something you see in the woke ideology, where there's the sense that like, oh, everybody in the past was so ignorant, they were so biased and prejudiced, but now we are liberated from all that. Now we understand. And I think there's some truth to that we can hopefully make progress and discover things. But if there's ever a sense that we've sort of achieved a sense of finality about what we know and understand as human beings, and then we've completely lost a sense of the mystery and complexity of what it means to be a human being and what it means to live in this universe, not only is it wrong, but it's also, I think, really soul killing. There's a sense of loss when it's like, okay, it's just a matter of these simple answers, and that's all there is to life. That's all there is to existence and being a human.
No nuance. We've lost the nuances and flattened people in a sense. And I was particularly struck here where you said that instead of fostering curiosity, it encouraged students to view the world through the reductive lens of power, because that word critical thinking is under the critical social justice lens, the word critical itself is synonymous with power, right? It's a power dynamic. It actually doesn't mean critical thinking, which in our way of understanding used to be that you can question, that you can, explore different possibilities, different answers, etc. But as you pointed out, even the word critical has sort of been reduced in this lens to a lens of power, which in this regard, and I just want to finish this because I really loved this part, a superficial commitment to diversity, a proclaimed value for the experience of minorities was negated, and all stories were subsumed under the oppressor-oppressed meta-narrative that arises from a belief in power as the ultimate reality.
Yeah, that was really striking to me. That there's, just as you just read, this superficial commitment to diversity, but it ends up flattening everything into one narrative. And this is sort of within a postmodern or critical theoretical mindset. There tends to be a distrust of meta-narratives, but it ends up inadvertently creating a new meta-narrative that subsumes all. And it is very kind of one note, everything is about power, very monotonous and incredibly.
Absolutely.
I mean, power, oppression, privilege, power, oppression, privilege, power, oppression, privilege, class after class. This was the lecture. This was the study drumbeat. This is what we're allowed to talk about and think about. And all things have to be looked at through that lens. And I want to say, valid lenses to look at the world through. It's important to analyze power. It's important to be critical of existing systems and take a step back and say, hey, are we sure this system is all it's cracked up to be? That's perfectly legitimate. But when it becomes one note, it becomes everything and subsumes all other things. That's when it gets twisted. So I don't, again, like there is, at least in theory, some really good aspects to what critical social justice could bring to the table, and saying, let's not assume that the established system has it all correct. That's just fine. But when it's applied in a certain way, or sort of expands like a kind of cancer that subsumes all things, that's where it gets it goes sideways, I think.
Right.
As I saw in this program.
Right, and it's been used as fuel for radicalization, for this constant paranoid suspicion that we have of others all the time. That we need to interpret their intentions and behavior only through this lens, power as attached to identity, right?
Yeah, and so if I can, like, maybe this is an appropriate place to go into some of the more meat of what I encountered in this program.
Go for it.
Where if what we're always thinking about is power and oppression and this oppressor oppressed
binary
narrative that happens in culture, then yeah, whenever we're with a client, we have to be looking for what are the dimensions in which they are an oppressed class, so we think of them as a minority person in some way, so, and if they fit into an oppressed class, then we must approve and celebrate whatever that is, blanket, without any kind of deeper thought or consideration, and attempt to overturn that oppressor oppressed dynamic. And then that's what it's all about. So there was a fixation throughout the program on what they would talk about as sexual minorities. So obviously this would have to do with the LGBTQ community, but it would also have to do with BDSM, which is
paraphilias.
All that stuff. Kink, polyamory, all of those things. And it's perfectly legitimate, again, to talk about those things and discuss them from a thoughtful mindset. But when it becomes, we just have to celebrate in a kind of knee-jerk way without paying attention to what might be the underlying themes that are coming out in this person's life that are affecting them and why they're looking for therapy, as opposed to just, all that's happening here is you are an oppressed person and we have to overturn that and celebrate this. And so it becomes this, in the program that I was in, it became this fixation on the problem in all people's lives is oppressive, moralizing, conservative values. And if we can liberate them from that oppressive moralization, then all will be well. And there's nothing about, maybe life is complicated. Maybe relationships are difficult. Maybe sexuality is a complicated area of life, and we get into trouble in our personal relationships because personal relationships are hard, not just because you've been oppressed by a bigger system, if that makes sense.
Well, I think it's really interesting that, there's no hiding. It seems like it was very much in your face that was the agenda of your program. I mean, you have here, in your book or in your chapter about the keynote lecture person that came in, and the speaker declared that the world is socially constructed, right? And that I'm not here neutral. I'm here to try to recruit you to a particular kind of point of view of how kink should be viewed. This to me sounds very, and I'm doing a little bit of work on cult, on doing some writing about cults and the cult thinking. So it's outside of CTA, but it strikes me, this person that comes in and says this, because it has a lot of the flavorings of kind of that cult mindset, which is again a side project here. But can you speak to this a bit too as well? I mean, to be so open and emboldened to be able to say that without any pushback, and actually it seems as though this is a supported lecture by the school, that they invited this person.
I was kind of an odd duck in this program because I think most people who came into the program knew what they were getting into, and somehow I kind of stumbled my way in. So most people were like, great, yes, fantastic, wonderful. And I was going, wait, what? I thought we were going to be sort of wrestling with things in a deeper way with more complexity. I want to say something very clearly, that it's not like I have an agenda where I'm going, oh gosh, kink, oh gross, ew, let's condemn that, let's be against that. I'm not saying that at all. I'm saying it's not really our role as therapists to sort of make these moral agendas on behalf of our clients or on behalf of the world.
That's the point. It's an amoral process that we're engaged with.
So so there's a striking, like this moral opposition to moralizing that then becomes a knee-jerk, like a celebration. It was really a strange thing. Whereas like, can we just be curious about a particular person's story without it being subsumed by this broader narrative that then prevents us from really engaging the individual in a thoughtful way?
So the needle actually shift from moral condemnation to moral approval. it's still moral involvement. Morality still plays a role in telling the person what they should or should not do.
It gets a little tricky because we're in some sense saying we want to be amoral. At least we're not. Our role isn't to pass moral judgments, but also we do need to explore and acknowledge that there is a moral dimension to life. That to be human is to wrestle with morality and to hold morality. So how do we engage that without becoming sort of partisan or doctrinaire about it? I think that's complex, but
it is complex.
The hope within this program was if we can just remove the moral dimension from human life and not talk about it, then everybody will be better. And I was like, no, that's not exactly how it works, I don't think.
And Christina and I have also discussed this, where you would have to have this frame within which you work, where from a psychological perspective, and also your understanding, regardless of what modality you're working from, where you would try to understand what the person is trying to express through this sexual behavior.
Yes.
How it works for them.
Yes.
What is underlying this sexual behavior. To have this curiosity in place, as opposed to just having
bringing out the pom-poms and the sex positivity movement and slapping an affirmation, this over affirming kind of behavior and attitude.
This blindness that is being introduced, where you're so scared of questioning that you just want to celebrate, and certain topics remain taboo topics. You don't touch that. You just approve, you just affirm, and you celebrate. But this thing goes back a long time. I remember quite a few years ago when I read an article, or actually a book by a psychoanalyst called Otto Kernberg, where he said, specifically with homosexuality research and psychoanalytic research of homosexuality, where he said that the field has become so politicized that we cannot do research in this anymore. And he was not homophobic. He was fantastic in terms of his psychoanalytic understanding of sexuality and sexual expression. This has shifted not only from homosexuality now, but now it is prohibited. It is a minefield to research gender and gender expression and gender identity. It's a minefield to research the psychoanalysis of autogynephilia, because autogynephilia is closely related, at least in expression, how we see it, with transgenderism today. And it's a topic people don't want to touch, precisely because of this remoralization, this radicalized remoralization of a field. So it's striking because, like any therapist, if you might if somebody's in an abusive relationship, let's say a heterosexual abusive relationship, any therapist is going to start to get curious and help their client to be curious about, okay, what draws you to this person? What themes in your story might have contributed to you being drawn to this person? And how are you sort of replaying patterns consistently in your life that lead to you being in an unhealthy life circumstance? And so any therapist with regard to, let's say, a heterosexual relationship, you could practice that kind of curiosity, but then it becomes, as soon as it's a gay relationship or a kink relationship or polyamorous relationship, or as soon as it has to do with the expression of gender dynamics, then it's like, okay, we're not allowed to think about that anymore. We're not allowed to question what the themes are. We're not allowed to be curious about your story. It's just wonderful, how amazing that you have come to this sense of yourself as a person. You have freed yourself from oppression. We celebrate you. And then therapy becomes just about discussing the ways that society is oppressing you. And so there's a shutting off of the brain that occurs as soon as any of these oppressor-oppressed dynamics gets triggered. And you go, okay, we're not allowed to think about that anymore.
And this, I have to say, just really kind of set me on fire here, that the section where you asked the professor in the program, one of your professors, whether these very young children were psychologically ready for exposure to some kinds of sexual content, And that the response to you was that age appropriateness is a conservative myth.
Yeah.
It's no age is too young to encourage a child to wonder whether they identify as non-binary, polyamorous, kinky, or pansexual. I mean, it is akin to what they're doing in California right now by removing the word pedophile and changing it with adult person who's attracted to minors, because they're trying to normalize pathological predatory sexual behavior. So when I see this, the first word I think of is grooming. This is where the grooming almost starts. When you start to remove any level of age appropriateness, we're not titrating information anymore, right? Based on what they can cognitively and psychologically tolerate. We're now just giving it to them.
Yeah. And so there's this sense again that all of the problems in life are created by sort of oppressive moralizing. And so if we can just get rid of that, then we'll have a free, open playground where we don't have to be afraid of anything. And so, yeah, we can just, as long as we're willing to have an open, thoughtful dialogue with kids, they're ready for any information. And that goes hand in hand with just something that really struck me consistently in this program was there was this fixation on child education. It's really important that we get this into schools as early as possible and get kids thinking along these lines as young as possible. And at the same time, on a personal level, very few people that I encountered in the program had kids or had any interest in having kids. There was a sense that like family life was this boring, conservative, mainstream thing to do. And yet at the same time, we're really fixated on educating children. I suppose if somebody's really putting themselves forth as an expert in education, not in every case, but I at least want some of those people to have raised children, to have relationships with children so that you have some sense of what it might be like to raise them. Now, I'm not saying it's a litmus test or requirement that you can't be in education if you don't have kids, but if there's this wholesale disinterest in having children across the board, while at the same time being very fixated on educating children, I find that strange and troubling.
Especially since they have no skin in the game.
Yes.
Yeah.
Well, maybe that's what it is. And you have groups out there, which I won't name names, who are supporting or trying to back, in their effort to not censor. So here we go again, a good idea. Okay, that's been then tainted, and it's not censor, right? They're supporting reading material for kindergarten age, first, second, third, fourth grade, reading material that is sexually explicit. I mean, you could almost call it borderline pornography, to the point that parents that are reading excerpts of some of this material at the school board meeting, for example, the school board themselves is saying, please stop reading that. It's not appropriate. So it's not appropriate to read out loud what your child's library at school has in cartoons and pictures to describe masturbation and all of these other components of the sexual experience and all these other types of sex. So it's the effort to not censor is kind of what they're hiding behind in order to put this front and center with these kids. And then of course I go to, there's an agenda here or a motivation here, and maybe Jaco, you might want to jump in, because I know you probably have thoughts too, but that's just there's an end game here that's very distressing to me. Whether or not it's intentional, the end game is still distressing.
And there's a big chunk of that goes back to the oppressor-oppressed narrative. And when that story of oppressor and oppression gets held so strongly, as soon as something begins to look like it could be shoehorned into that narrative, then it suddenly takes on a whole lot of momentum. And so I can speak for, in this program, there was often a sense that parents have power over their children. And that's not good, because then parents are oppressors of the children. And so then it suddenly becomes the role of educators to free the children from the oppression of their parents. And so now there's this push to turn education, instead of sort of cooperating with the parents as they raise their children. We have to sort of
correct parenting.
You correct, absolutely, and
wow.
conceal what we are doing in schools from parents. I mean, that was overtly discussed in the program. The parents are the problem in many of these cases.
So they have this agenda of queering everything.
Yes.
Queering means to undermine oppressive power structures, and they consider any prohibitive structure, any withholding structure, oppressive.
Yeah.
And that is why they would imagine that.
Yaku, about queering, just one more time for our audience that maybe doesn't know about these terms.
Oh yeah, so queering is this concept that any prohibition is necessarily oppressive. So in our society, there are structures that allow certain things and that prohibit certain things. Certain roles, for instance, are such structures. Age roles,
yes,
gender roles, family roles, etc. So queering then would be the process by which these roles and these structures would be dismantled. If they want to queer gender, they would say, oh, if this is typical socially accepted male gender expression, how about we queer it? And we say we are going to adopt typically female gender expressions and call that maleness, and vice versa. Or the whole concept of gender altogether, they would queer.
Right.
But now they go further and they would queer parenthood, like you just said. Or they would queer age. So now what we would typically in our society ascribe to certain ages, certain people doing certain things that are permissible according to their age, they would now start queer. And this is where we run into trouble, where they would say, oh, since we are queering age and childhood is age related, now we need to dismantle and undermine the prohibitions around childhood. And this is where pedophilia gets introduced, where they soften the impact of pedophilia by regarding pedophiles as minor attracted persons.
Correct.
And the next step would be where they assign adult categories to children. Yes. And that is why children are no longer considered, children who are gender confused are no longer considered children that have gender dysphoria.
Yes.
They are given the adult category of transgender children.
Yes.
We don't talk about proto-sexuality where we speak of children anymore. We assign adult categories to children.
Even gender dysphoria is an adult category.
Precisely. And now they even go further than that.
Absolutely.
They take a step further than that, and the new concept that is being coined is adult attracted minors.
Yes, that's
oh,
California.
Wow.
California has passed. Yes.
Wow.
Has passed this new language or law to where they're trying to remove that word pedophilia and give it that correct minor attracted persons.
I was curious to hear from you, even though Tim, you said that there were these moments where you could see that people were venturing into the field of pedophilia and depathologizing pedophilia. Right toward the end, the only prohibition they upheld would be pedophilia.
Yeah.
Which would be a contradiction, not so?
There was kind of a shift that would occur when pedophilia would come up, where there was sort of like you saw people sort of inner conservative moralizing come out, and they'd be like, oh, but that's really terrible, so I didn't see in the program an overt normalizing of pedophilia or trying to sort of make that okay, but it was striking the shift that would occur, the sort of cognitive dissonance as people jumped from one mindset to another when the topic would come up. There was a discussion of using the phrase minor attracted persons in order to make a distinction between, let's say, somebody who struggles with being attracted to minors as opposed to somebody who has actually acted out those attractions. But that wasn't being my sense of it wasn't in an attempt to sort of move towards making it allowable, except I'm going to talk out of both sides of my mouth, because like there was, let's say at one point, a discussion of, they said, like, say with young gay boys who might have difficulty finding sort of peers or sort of mentors to learn about their sexuality, or people to sort of experiment with. Sometimes you might have young gay boys who end up having relationships with older gay men. And we sort of, I can't remember the exact wording that was used, but we sort of look at that a little bit differently because of the difficulty for young gay boys of finding people to learn from. And so there was like, they didn't quite come out and say it, but it came right up to the edge of saying, yeah, it's sort of okay when older gay men have relationships with younger gay boys.
I just want to say, right from the beginning, right from the writings of Herbert Marcuse, who was the political theorist who co-opted psychoanalysis to further his political theory, he was obsessed with man-boy love. In his Eros and Civilization, he goes into that. We know Foucault was into minors as well. He was a hebephile. The first queer author, Gail Rubin, goes straight into man-boy love. These theorists had right from the beginning an agenda, and that is to normalize pedophilia. So hence my surprise at the contradiction in that training, but also my non-surprise at the sentiments that did seep through. That there was a bit of a tolerance leaning towards that.
And so with what I was saying there, I want to I guess perhaps make a distinction between where do I think this ethos of sort of woke ideology is heading, and what energy does it tend to sort of lead towards, versus what was explicitly taught in this program. I just want to be careful not to create sort of a mustache twirling villain of this program that is an exaggerated form of what was actually taught there. There was some really awful stuff. And at the same time, I think you're completely right about what some of the origins of this mindset include.
Yeah,
that makes sense.
I mean, I think a lot of what we all kind of talked about, and in general in the book, I mean, just other authors as well, was sort of a combination between what you're talking about, what we currently witness, but also what we're foreseeing, or what is likely to happen if the road we are on continues to go uninterrupted. So, there's a lot of, I think, broader implications that the authors, all of us, kind of suggested were on the way, or were there, or maybe the unspoken, the open secret, or even the whatever it is, it's we're on this, kind of, we're about to cross this Rubicon, so to speak.
The things that are overt are troubling enough.
They're already troubling.
When we're talking about sort of providing young children with easy access to puberty blocking medication and cross-sex hormones and sex change surgeries, that kind of stuff. Okay, we're in a world that would have been unimaginable, I think, even 10 years ago. And so we don't have to, even if we don't speculate at all about where it's going, where it is right now is
already
shocking.
Yes, it's just terrifying. And I think it's tough to see some of my colleagues and trusted, colleagues and friends and people who I have been very close with over the course of my career have such a stark opposing viewpoint than me, because they're somewhat engulfed in this as well. It's very disheartening in a lot of ways.
It makes it really difficult to, I mean, what I experienced in the program was a sense of alienation. We're like, oh gosh, this is a place where I can't speak. If I do, I might get in big trouble. And I mean, I wrestled with that throughout the program and tried to maintain my integrity as well as I could, and sometimes did sort of out myself as a wrong thinker within the program. But it definitely creates an atmosphere in our profession where there's,
Mm-hmm.
I mean, that kind of fear is really effective as a silencer, especially for people who are just, I mean, thankfully I've had my degree for a long time. So, but people who are in a position where they might not get a degree or get a license if they don't toe the line, man, that's really, really difficult.
Yeah. The self-censoring.
Yes.
And this is what you're alluding to when you say under the subheading, instead of curiosity and a value for multiple viewpoints, power as a reductive lens for all of life.
Mm-hmm.
Very simplistic. Even so far as they go as far as approving of the fiddling with research outcomes to promote a certain position on sexuality.
Yeah, that was openly discussed at one point by a professor, saying, there were questions coming up about the extent to which, let's say, sexual orientation or gender identity are fixed at birth versus malleable. And the professor just came out and said, well, when, at a certain time in culture, when we were sort of trying to advance certain goals for freedom and rights, we emphasized one thing. But now that we've made some headway and the cultural narrative has shifted a little bit, we're willing to admit that, no, these things are a little bit flexible and people do experience them as fluid. So it was just a straight up acknowledging, there has been distortion of what is true scientifically about the extent to which these things are or are not fixed. I don't have a dog in that fight. Like, I'm not trying to say it is one or the other. I'm just saying, gosh, the question of scientific accuracy shouldn't be subsumed under, we'll just make the scientific statements we need to make in order to advance certain political agendas. That's really messed up, especially in an education program at a university that's saying, where this is about expertise, this is about what's true, this is about what's scientifically accurate, and we're just saying flat out, no, we distort the science in order to meet certain political agendas. Wow, that really struck me. And nobody batted an eye when it was said. I was,
well, it's condoned. I mean, it's completely, so there's no reason to bat an eye, I suppose, if it's condoned, if you agree.
So when the woke say science has been used in the past for corrupt ends, they don't really mean that what science did was wrong. They just mean that the wrong people did it, because the woke do it themselves. And if they need to do it in order to promote a certain end, they'd be more than prepared to do it anyway.
Yeah, well, and if all language is just a power game anyway, and everything is power, then the only thing to do is to turn it on its head and use the same means in order to overturn power structures. There's no belief in truth or reality. There's just power. And as long as you're punching up, so to speak, have at it.
Yeah.
So where do we go from here, Tim?
Great question. It's funny because we're talking about what's happening in therapy, but we're also we're talking about what's happening in society as a whole, like across institutions. This sort of stuff is happening. So I'm kind of like, gosh, where do we go from here? Well, if I had the answer to that question for therapy, I could also be the leader of the world. And
right.
I was thinking, like, so I don't have the big picture answers. But I think the biggest thing that we can do is individuals have to do integrity checks and speak honestly. Don't lie. Do everything you can to walk with integrity, and don't go along with the crowd just to get ahead in your career. And I recognize, like I said before, that that's difficult for somebody who's choosing between, if I speak up, I might not even get to have a degree. Man, that's a really difficult spot to be in. But as much as possible, we have to not perjure ourselves to ourselves, because once you go down that road, it's hard to back it up.
It is. And I think, I get a lot of emails or dings on, messages on LinkedIn. I'm not really active on social media, just for a lot of reasons. but people will reach out and just say thank you for saying something, which, you know, we do this work voluntarily. I mean, this is kind of just how CTA even started. It's a group of people who just care about the profession.
Yeah.
And that answers has always been the same to those people as what you're saying, which is, you know, I got to a point in my career, I'm sort of on the back end, the other side of it, to where, you know, God forbid, first of all, I've established enough experience to have a lot of flexibility with what I do. But other than that, you know, God forbid something were to happen, you know, to my license or something like that. First of all, I would fight it till the death. But at the end of the day, I can afford to take a hit if that were the case, for the sake of pulling the curtain back for those who are new, just starting. They're just trying to build a career, and they really can't do that, or they won't make it. They will not be able to pass all of those, you know, points of finishing your hours and tests and whatnot. So that's kind of just been my response as well. I'm in a position where I can right now, so I will. That's what I'll use my education and you know, interests and passions to do, is to just expose and to say something, see something, say something, as they say.
I think there becomes a question for those, say, younger people, not always younger, but people who are newer in the profession. And it's like, okay, well, you might not get this degree if you don't speak up. Do you really want that degree? I mean, there was a point in this program where I was like, I kind of hope I do get kicked out of this program.
Yeah.
Wouldn't that be good? And at the same time, I don't want to be flippant about that. I know that's a difficult choice for anyone. So everybody's got to do their own gut check.
They do. You know, I just did this, you know, Leslie Elliott, this Antioch student I mentioned to you before. We just on the last live stream we did, this question came up specifically, like it was directed at me because she's not licensed, you know. Where do we go from here? What happens, you know, what do you do? Do you continue on and sort of drink the Kool-Aid as much as you need to in order to get licensed? Do you change your, you know, profession altogether and pivot? You know, do you start a parallel kind of, you know, which is something Leslie's doing? So it's, you know, there comes a point in time, and at least for me, where I could only to a certain extent, I could push this envelope as far as I could push it. In my role as a woman who's not white, I had more ability to do that without people saying a whole lot to me. But that in and of itself is the actual problem. That in and of itself is completely unethical. So while I could utilize it as, you know, kind of a tool to get my own personal message out about all of this being, you know, not the way I want to teach in college, and this is how I will teach, at the same time, the fact that that has to be used in that way is already in and of itself a problem. That was the moment where it was like, okay, I'm now becoming that very same thing in a sense, in order to kind of counteract or push back against something that doesn't feel right either. So these are big decisions that people are facing when you've spent $100,000 in graduate school.
Yeah,
right.
absolutely.
And you need
it's
to
scary.
put 3,000 hours, and however much it is for you all, you know, Yaku over there in Ireland and the UK and other continents, South Africa, I don't know how much, you know, but I'm sure it's quite a lot, you know, of money and time and hours. And then can you do that and still maintain your own personal integrity when you eventually practice on your own? Because you change. I mean, the work changes you, I think, in some extent, degree. So
you can only wear a mask for so long before the mask kind of becomes you, or you lose the ability to distinguish.
Yes, you lose the ability to distinguish.
There's a big cost to starting to say things that you don't really believe.
That's it right there. That's like the underline. I want to underline that sentence. Yes.
And we're talking about this theme of sexual education, and what just came to mind would be the experience with Tavistock and the Portman clinics there in Britain, and how they gradually succumbed to pressure from activist groups.
Yes.
And they were co-opted, and they eventually lost their therapeutic frame and therapeutic integrity.
Yes.
And started to engage in grossly unethical behavior. I'm reading this book by Hannah Barnes, the journalist who did some investigative journalism on the Tavistock Portman clinics. And that is where you see that as soon as you start failing yourself in terms of your integrity and things go wrong, you will have no one to stand by you because you failed yourself. See?
Yeah. Yeah. Yeah, that's really good.
And that is the difficult position many upcoming therapists and practicing therapists are finding themselves in.
Yeah. Another thing that comes to mind that maybe follows on the heels of that is still in terms of walking in integrity as individuals, is that every kind of, let's say, how do I say it? There's this KoolAid that a lot of people have drunk that we're talking about, but every kind of KoolAid has its own equal and opposite dark side of the KoolAid. And so what I mean is there's lots of people who are very woke. And so then we can become the people who are just as staunch and blind and knee-jerk in our own anti-wokeness. And then we're just warring dark mirrors of each other.
Yeah.
And so we lose the ability to think, but in an equal and opposite way. And so I think that's where I want to be careful as well, not to straw man and not to create a caricature in my own mind, but to really continue to think and be curious, even about my own assumptions. And I think that because you see this all over the world right now, but especially in the political landscape in America, where the right and the left are tearing each other to shreds and often look a lot like one another, but don't have a clue that of how similar they are in many ways.
That is so true.
And that's not to say I don't have opinions that fall on one or the other side of the spectrum in this or that area, but I want to be mindful of how much it's true that you are what you hate. And you become the thing that you cast into shadow.
That's valuable.
Absolutely. That is the moment at which personally I made the decision that I needed to leave. When I started to toe the line, and I was falling over that kind of cliff, and it was going to go one direction or the other, and I needed to not be in either direction, though they were both extreme. So that was the point at which, okay, Christine, check yourself. It's time to step back, which ironically happened during a medical leave. I took had some surgery. So I had to actually be not working in order to be able to see that moment for myself.
And it's valuable. It is valuable that we all also hold each other accountable.
Yes.
Yeah.
To not radicalize like that. And I appreciate that you guys in America find yourselves in a very, very polarized environment. That pressure is there all the time.
Yes.
Over here, it's different. It's slightly different. Even in Britain, it is slightly different. The pressure is there. The cultural shifts do take place, but it's certainly not as hostile, as deadlocked as you'd find yourself, as you two would find yourselves there in the US. But still, we need to hold one another accountable. Do not fall for radicalization. What we're observing here and what we're discussing here is not a woke problem. It's a human problem.
It's a human problem. That's exactly right.
And in fighting the monster, we need to be aware that we do not become the monster ourselves. So communication, playing devil's advocate, this needs to be a practice that we need to encourage among ourselves as well, to remain open to new possibilities all the time.
That's where, like, I would never want my involvement in this work to be just like, oh, it's a takedown, like we got to get them,
No.
I'm just not interested in that. Like I can get sucked into it, but I didn't get into this work of therapy because I wanted to be a culture warrior. I really don't. I want to love people,
We had a conversation too earlier because I did my author interview today with Yaku, which he knows pretty much everything about my career history at this point. But that was kind of what I had said is the sadness of that. I didn't get into that because I wanted to be this tyrannical or fight back. I find myself in an effort to sort of combat, quote unquote, the activism that's injected. I find myself being an advocate now, or leaning toward advocacy to protect the industry. That's not exactly what I want. You know, that's not that is not what I got into this to do. I was very emotional about it. As a matter of fact, that the art of therapy to me and the beautiful dance that occurs in that room is so precious. And that to me is it's what I get from teaching too. And that to me is what drew me in, and that has been, you know, tainted and sort of taken. I've, you know, there's a lot of a lot of trying to deal with what that means and how I go forward with all that. So it's not what I signed up for either. And anyhow, in some way, you know, I feel like I'm doing some advocacy work right now on the other side, but
you're a social justice warrior.
Right. No. But, you know, I think it's more about the kind of the trying to protect the health, or the, you know, we're at an inflection point too in our career, in our field. I mean, I think we're going to see some things historically. And I think you would agree with this too, Jaco. And we've talked about this with Val a little bit too. Just this is an inflection point. There's going to be a moment, you know, in generations from now, people look back at what happened to the field of psychology and therapy. And these moments are going to be in that history book. The outcome, I don't know what that's going to be, but these moments are going to be written about as inflection points where we went one way or another.
Yeah.
The lads there at Trigonometry, they talk about a post-work focus as opposed to an anti-work.
Yes.
I like that.
I love that.
Right, I like it. Now, obviously, post-work would include things we would stand for, values we would endorse. They would be not work. They would be against what the work would stand for. But our values would also be independent values in which we focus on health. We still have the healing ethos in our psychotherapy. We would focus on research topics and research questions that are no longer considered taboo, even though the work might consider them taboo, so that we can regain our liberal stance, being free to inquire, be curious, and to be cautious in terms of the conclusions we might draw, just as what you said, Tim, in the opening words of your chapter. And that is, and with it all, to what would drive us in this post-woke imagination would be the love for people, the care and concern, the fascination we have with people.
Humanity.
Humanity, that's it.
I love that, because it's there's always this temptation to become about what we are against instead of what we are for. And it just goes back to classic things, almost cliche things, you know, like hate cannot drive out hate. Only love can do that. That when we're about what we are trying to support and uplift, we are more powerful than when we're trying to tear down. That's part of what first struck me about the woke ethos, is that it is often so much about explicitly dismantling systems, taking things apart. There's this, I know what I want to tear down, but I don't know what I want to build. And I don't want to fall into that if I can avoid it.
Beautiful note to end on.
Thank you very much. Tim,
thank you so much. This has been such a rejuvenating and just, you know, profound conversation. They're all so different, and yet we all, I think, at the end of the day, share such similar values about what we want to be doing and what we are doing. And I commend everybody's bravery for contributing to the book. People just put all their truth out there, and it really helped me understand why we couldn't get a traditional publisher. So
grateful to be a part of it. I'm honored to be a part of it.
Thank you, Tim. It was lovely to talk to you. Hope to talk to you soon again.
Thanks a lot.